and welcome to Questions That Need Answers. I am your host, MarQuisia, and tonight we're joined by a live audience. This is the Fit and Fabulous Health and Wellness Podcast, and our guests are here to discuss matters of the heart. Our first guest is Dr. Shawna D. Nesbitt, MD, MS. She's a professor in the Department of Internal Medicine at the University of Texas at Southwestern Medical Center, Dallas, Texas, where she is the medical director of the Hypertension Clinic at Parkland Hospital. Dr. Nesbitt earned her medical degree at Hahnemann University School of Medicine in Philadelphia, Pennsylvania. After an internship and residency in internal medicine at Allegheny General Hospital in Pittsburgh, Pennsylvania, she underwent fellowship training in hypertension in the Department of Internal Medicine at the University of Michigan Medical Center in Ann Arbor, Michigan. She is board certified in internal medicine, and she is a fellow of the American Heart Association Council for High Blood Pressure Research and a fellow of the American Society of Hypertension. Welcome, Dr. Shawna Nesbitt.
Thank you so much, MarQuisia. Lovely to be here with you.
Thank you for joining us. And also, we have Ms. Talia Stafford. Talia is the president of Phoenix Marketing and Media, a Texas headquartered media and marketing firm. As Phoenix Marketing and Media's principal, she oversees the daily account management, brand strategy, and marketing execution for influencers, small businesses, and startups. The agency also manages consumer experiences for clients that have included AT&T, University of California, the North Texas Tollway Authority, Dallas Area Rapid Transit, and of course, Alpha Kappa Alpha Sorority Incorporated. Welcome to Leah Stafford.
Thank you. I'm excited to be here. This is a great conversation already.
Yes, ma'am. Yes, ma'am. Now, ladies, before we get started, I have a quiz. And so we're going to start with a game. And so we're going to put up the game called Questions That Need Answers. And they are questions that deal with matters of the heart. Are you ready to play the game?
All right, let's go.
All right, let's go. Question number 1. How many times does the heart beat each day? Is it 100 times, 10,000 times, 1,000 times, or 100,000 times per day?
Per day. Is it D?
It's D. Very good. Very good.
I'm so happy. One question right here among this panel. This is so much pressure.
Well, no. This is good information. Question number 2. Over the course of the day, your heart pumps 2 gallons, 20 gallons, 200 gallons, or 2,000 gallons of blood.
It's D.
Is it D? Oh, wait a minute. Let's see. It is D. You got it. 2,000 gallons of blood. Question number 3. How many miles? This might be a hard one.
Oh my.
How many miles of blood vessels are in your body? Is it 60,000, 6,000, 600 or 60 miles?
I'm going to stick with D, 60 miles.
I'm going to go with A. Yeah.
It is A. You are right. Dr. Nesbitt, it is A. 60,000 miles of blood vessels are in our body. All right. Question number 4. Okay, this is a question. The most number of heart attacks occur each year, is it on Christmas? Is it on New Year's Day? Is it the day after Christmas? Or is it on Mondays?
Oh, wow.
That's a good question.
Oh, that is a good question.
Yes.
I'm going to go with January 1st, the day after New Year's Eve.
Right. And I'm going to go, just to make it interesting, I'm going to say B, the day after Christmas.
Well, let's see the answer. It's actually Christmas Day
And Monday.
and Monday.
Wow.
Christmas Day and Monday. Yes. All right. Question number 5. Okay, this is a true or false. Men and women experience similar heart attack symptoms. Is it true or is it false?
That's false.
It's false. It's correct. They do not experience similar heart attack symptoms. Very good. Very good. All right. Let's continue on. Question number 6. Here's another one. Sneezing stops your heart. Is that true or is that false?
True.
Yeah.
Is it true or false? It's false.
It's an urban legend. Okay.
Sneezing does not stop your heart. All right, let's keep going. Question number 7. Okay, there's one statement that is not true. One of these statements is not true. So the average adult resting heart rate should be 600 to 100 beats per minute. That's A. Newborn babies have the fastest heart rate at 70 to 190 beats per minute. That's B. Athletes may have a resting heart rate of 20 to 40 beats per minute. That's C. Or D. The American pygmy shrew is the smallest mammal, but it has the fastest heartbeat at 1200 beats per minute. Which one is false?
I was going to say C.
The correct answer is C.
Really?
Athletes do not have a resting heart rate of 20 to 40 beats per minute.
They can, though.
Oh, okay. Well, we'll get into that later. We'll get into that.
Yeah, they can. They can have very slow heart rates
Interesting.
because it depends on how fit they are.
All right. Very
And
good.
Babies, the heart rate of a baby is usually higher than 70. That would be a very slow rate for a baby.
Okay. Well, we will get into that in just a moment.
Yeah.
All right. Here we go. True or false? Sitting is an independent risk factor for heart disease. Is that true or is it false?
Sitting. I wonder if they mean idle.
You mean sedentary activity?
Yeah.
Just sitting down.
I'm going to say true.
If you're calling that sedentary activity, that would be true.
It's false. It's false.
I'm going to call that a issue of how the question's worded.
I like your style.
Because that's kind of true.
All right. We'll get into that some more. Okay. This is good. All right. Risk factors for aortic dissection include A, uncontrolled blood pressure, B, atherosclerosis, C, aortic valve defects, or D, pregnancy and delivery?
So this is what happened to me, so I should know this, but I feel like it's between two answers. So
Okay.
I'm gonna say A, uncontrolled blood pressure, but I think it could also be C.
Um, so pregnancy and delivery is not really for aortic dissection. The aortic
Okay.
valve defects, yes. Atherosclerosis goes with it, and uncontrolled blood pressure most definitely is part of it.
All of the above.
Oh, okay. It was one. Okay, perfect.
All of the above. Great, great answers. Okay. And our last question. The number one cause of death in the United States is
A.
A.
heart disease. A is the correct answer. Good job. Thank you so much for participating in the opening quiz. That was a job well done. And we have some very insightful things that we discovered um, in the quiz there, which leads me into my first question. What is an aortic dissection? Since that was a question, what is an aortic dissection? We'll start with Dr. Nesbitt, and then we will let Talia share.
So I'll back up and just give you a little bit of the picture of the anatomy. Is imagine that your heart is the pump, and you have a big pipe connected to your heart where the blood is pumped into to get to all the rest of the body and blood vessels. So that pipe, the aorta, comes up like a hook and circles down, and it has branches everywhere. From the inside of the heart, when blood is squeezed through, it goes in through the middle of the blood vessel, kind of like having a pipe from your sink. But if you can imagine, if the wall of that pipe is a couple layers thick, that if something happens to split that wall, then blood can get between the wall instead of in the open part of the pipe. And because the pump is so vigorous and strong, every time your heart pumps, it splits that wall even more, kind of like the lining in your coat would split away from the coat itself. And the further it goes, every time it passes one of the branches, it blocks off the blood flow that's supposed to be going to some other part of your heart. So the dissection could be from the heart all the way up and around down to your legs, or it can stop in the middle somewhere, depending on just the anatomy of the blood vessel itself.
Right. And Talia, you experienced an aortic dissection, is that right?
I did. Yes. One of the things that a lot of people think, especially once I, went into the hospital, is, of course, most people just think it's a heart attack. So thanks for the definition, because it is, when you say doctor, it's very different than a heart attack. But I think people do need to know about it, because it's a lot of times it's missed. But that did happen to me, and May of 22. I fortunately had just gotten back from New York and had been traveling, and I was very happy to be at home, and I was getting ready to have my first cup of coffee, and so I felt a tear. It actually felt like a tear in my chest, and then I thought, well, maybe I'm having a stroke. I checked my blood pressure. My blood pressure was okay, and the interesting thing is, there was no other feeling after that.
Mm.
So there was no additional pain, nothing after that. So I want people to know, even if it went away, there wasn't a long going pain. But I told my husband, I said, well, I have a hair appointment at 2. And it's hard to get in for the hair appointments.
Oh, yes.
Yes, yes, and she's gonna think this is an excuse. Um, but
Oh my gosh.
yes, but I did go to the emergency room, and then I'm sure we'll talk more about that. But went from that conversation straight into open heart surgery.
Wow. So you
Yeah.
mentioned that you felt a tear.
I did.
And where
Yeah.
did you feel that tear?
So, it's interesting because I felt like I could see the color purple, So the movie Color Purple's been
Mm.
out. I'm like, how can you describe it best? But and in that moment, I felt a tear. It was almost like you could feel, like she was saying about the pipe or about something that's got pressure on it. So almost like a blowout of a tire.
Mm.
Um,
Hmm.
and then I felt like my face was purple. It was like my jaw locked. And
Wow.
so, and then by the time I got to my bedroom, nothing. Took a shower, and I could have probably just kept going for the day. So even when I was, I had to go from one hospital. They had to, not care flight, but had to take me to another hospital, which we'll talk about. But I was awake the whole time. They said, they actually never seen anyone who was awake talking, and
Mhm.
I was working on a souvenir book for the sorority. So I was sending emails to my team like, okay, we still need to get the deadline because. So fortunately for me, I was not. I didn't have a lot of symptoms after that.
Yeah.
That's the
Wow.
scary part.
Yeah. That's unusual. Most people describe it exactly the way you describe it, as it feels like a tear in the middle of the back, straight down the middle of your back, because the aorta is kind of towards the back of your body. And afterwards, it actually, more people talk about it being just a consistent pain, and that pain is sort of stabbing
Mm,
um, in that area, kind of like somebody stabbed you in the middle of your back. That's kind of the way we talk about it. Um,
Mhm.
you're very blessed not to have, significant blockage of the blood vessels,
absolutely.
because it really does limit the flow to the kidneys, to every single organ, including can cause strokes, because obviously the blood vessels to your head are coming off the split happens,
Right.
determines what's going to be blocked, in terms of the blood flow to the
I have
organ.
I have heard that. I've heard a lot of stories after about the statistics and how rare and fortunate um, my particular situation is, and so being on a podcast like this, it's I'm very thankful, and then you hear about it a lot more. So like recently on the news, when some of us might remember John Ritter from like Three's Company or whatever that was, and
Yes.
his wife just came on to the Today Show because they started a foundation for aortic dissection because his was missed because most people do think it's a heart attack. So um, yeah, so I actually knew like enough to ask the doctors to scan my aorta, which we can get to that. But if I wouldn't have known a little bit more about my history and what was going on, they wouldn't have looked for it.
Mm. And so you say you knew you were not having a heart attack. What's the difference so that people on the podcast will know what's the difference between an aortic dissection and a heart attack? Dr.
So
Nesbitt.
a heart attack, if you think of it this way, these are blood vessel diseases, and the blood vessels to the heart, if you see what the heart looks like, you see three big arteries on the outside of the heart. Those are the supplying blood vessels to the muscle of the heart. On the inside of those blood vessels, we develop atherosclerosis. You had that in one of the questions. Uh,
Yes.
and that is because as we get older, from age 15, we start developing plaque on the inside of blood vessels, almost all blood vessels. And if that plaque gets to be so tight that you can no longer get blood through it, then the other side of that blood vessel is blocked, so that the muscle that that blood vessel is supposed to supply dies. And that's what we call a heart attack. So effectively, one part of your heart muscle dies. If you saw the heart after that happens, it looks like it's a dark black piece of tissue that just doesn't move anymore. And because it's not able to move, you can imagine the job of your heart is to beat
Yeah.
constantly and to be able to squeeze blood out. So if one part of that heart muscle isn't working, it's no longer beating like that, it's beating like this.
Mm-hmm.
Which means that the pump isn't as effective as it should be. That, in distinction from a dissection, which we are talking about, that big blood vessel that is supplying blood to the rest of your body,
Mm-hmm.
has now split the wall. They're two separate things, but in the same area of your body. And so a heart attack will feel like, many people describe it as, chest pain, an elephant on my chest. More men say that, less women. Um, just different than what Talia is describing, is more like a sharp tearing pain down the middle of your back. And a heart attack feels a little more like a stab in the front of your chest. It can radiate from the front to the back. And interestingly, we were talking about whether this is the same for men or women in a heart attack,
Yes.
where men talk about it being an elephant on their chest. I couldn't move. Women will say, it just felt heavy.
Mm,
My jaw kind of hurt. My shoulders kind of hurt. I'm a little bit tired, more tired than I usually am. I feel like I'm moving my body through
right.
mud. Very subtle symptoms that women tend to give, as compared to men giving very definitive, absolute, it's this, it's that, which is one reason why it is missed so commonly for women. Couple that with the bias that healthcare professionals have about women and about our complaints, is that many, many more times women are thought to have, you're stressed, you're anxious, you're just nervous, you're menopausal, you're
Right.
all these
Well, and
things.
we are all those things, but
And yeah,
but
we are
I
sometimes.
agree with you. Yeah, because that exact thing did happen to me. Is when I did, my husband said, "Well, not on my watch. Like we're going." And fortunately, my husband had experience. I mean, mine is just by the grace of God, and then having, like you said, the experience. It's kind of like when you take your car in, and mechanics have just kind of known, and they've done that before. And
Right.
so, fortunately for me, I had high blood pressure in the past. I was, before I started Phoenix marketing, I was, that corporate woman, and, working at Dr. Pepper, Frito-Lay, and, back to back on those meetings. And I was, having 3 kids, and those doctor's appointments get long. And I just didn't really have the time to get the medicines right for my blood pressure. And one thing I will also say is, I did not get my blood pressure managed until I started taking blood pressure that was not covered under insurance. So
Wow.
yeah, so I took Bistolic and amlodipine and lisinopril and a lot of other things, which I can touch on my experiences with that, or this might be another conversation. But I ended up over time just thinking, well, high blood pressure just comes with it. I
Mm.
can't, I can't get it much lower. So for me, I was having high numbers for a very long time. And what I didn't realize is that even when you get it under control, the damage has been done.
Mm-hmm.
So that is really the aortic dissection. The result is that at some point that was going to happen because it's been stretched over time. So, it's kind of like when we're those COVID genes that those COVID genes, they still fit, but
Ooh,
we're a
maybe,
size.
maybe not.
Yeah, but we're like, they still fit, don't they? But we've stretched them a little bit. And I feel, and so, I, I got remarried during COVID, and my husband fortunately is in the medical space and had a relationship with someone like you, Dr. Nesbitt, in the cardiology side, who had been a teaching cardiologist and was now doing what we call concierge medicine, which means they just, have moved kind of off the grid. They're not taking insurance. They're just treating individual patients. And thanks for humoring me. I'm going to make it short, but if we have questions, and he said, I can take you off 2 of those medicines and get your blood pressure down today. And I was on 5 at that point.
Wow.
And he switched out 2 of them to edarbichlor is what I take now. It's about $450, not on insurance. And if I would pay it. So anyone who's listening who's like, let me just keep trying the stuff that they're, take the chance on it. But it did bring it down. But because I had his number, and because I knew I had at that point an aortic aneurysm. So basically from all of those years of the blood pressure, I had essentially just an area on my aorta that had been strained that we were keeping an eye on. But even going to a cardiologist every 3 months, nothing could have predicted that would happen. So that could have happened at any place or time. But so when I went to the ER, the very first thing they said is, well, thank goodness it's not cardiac.
Wow.
Yeah.
The receptionist at the front, they just said, oh, well, I gave them the symptoms. Getting back to what we were saying, I said, told them exactly what I said. And she said, okay, well, great. So if it's in your back, then thank goodness it's not cardiac. So we'll just see you in a little bit. So, yeah.
Wow.
It is a really scary thing. And just to think that you had a classic setup for it with longstanding hypertension. And to your point, you are correct, is that, I think we have been conditioned culturally to think of blood pressure as, well, everybody has it. My mother had it, my grandma had it, and they're all still here. And it must be okay. It's not okay. I am here as doing what I do because every single family member in my life as a child had high blood pressure. And that was the only reason they were going to the doctor. Nobody ever talked about being controlled. I don't even know if they really understood that it needed to be controlled. And no one was really careful about what they ate, what they exercised, whether they took the medicine every day, what was the medicine actually doing to them, and how did it work? Never. And I will say, I don't think healthcare providers necessarily go to that extent unless you ask, unless you really make them spend the time with you to tell you what that means for you as a boutique patient. Because guess what? We are all boutique patients. Yes. I am not just anybody. I am me. And so take care of me.
That's right. That's right.
I don't buy that everybody gets the one size fits all. Not appropriate. But to your point, there are specific differences between these medicines, how they work, who really is going to, respond to them and why. And the combination of these drugs with each other, it's not just that any drug that lowers blood pressure is good, just throw it in the bag. That's not right. You wouldn't eat soup that just had every spice thrown in it. You want a soup that tastes great because the things complement each other, right? So it's the same thing, is that it should be complementary to each other, and it should be specific to you and what your needs are. And shame on them for not listening to you coming in, but you're unfortunately not the only one who has that story to tell.
Right.
Absolutely.
Now, let me just say this right here, because I've heard an old wives' tale saying that once you get on blood pressure medicine, you're stuck with it for life. Yeah. Is that true?
So I'll say this, 90% of Americans, Black, white, otherwise, if you live to be about 60, 90% of us are going to have high blood pressure. That's just the environment. That's the soup we're living in. Now, can you ever get off blood pressure medicine? So there are a couple things to think about here, is that what Talia has done a beautiful job of explaining to you in her own situation is this cumulative exposure. that she had over years. And we all have that cumulative exposure. The older we get, our blood vessels are aging with us, right? And so that change in the blood vessels also makes us more likely to have hypertension just because we're getting older. What helps your blood pressure to get better, and one of the things, let me say this, what makes us more likely to be hypertensive is what we don't do, is not eating right, not exercising right, not really managing stress, not really sleeping well, which is an important part of how our being. Those are all habits that we develop early in life, and we hold on to those forever. In walks the doctor to tell you you got hypertension, you need this medication. Well, now the medication lowers the blood pressure, but you haven't changed any of those things.
Right.
And so taking the medicine away, you go right back into that habitual life that you have maintained. And yes, the blood pressure will likely come back over time, although we have seen, and I've been in the leadership of a trial a few years ago that we found if we treat with some drugs like a Darbichlor, that taking people off for a short period can show that the blood pressure may stay down for a period, although in a couple of years it may start to go back up depending on how you are living life. So
And speaking on how you're living life now, how are you? What are you doing, Talia, to lower your stress and to eliminate those things that may have caused you to have the trauma in your body? What things? What? How did
Yeah,
your lifestyle change?
I got a new husband.
Yay! Congratulations.
Thank you. Thank you. But no, I think some of the things, fortunately I work for myself with Phoenix, and I, really leaned into adding to my team and working on some of those A personality qualities of, getting and imploring more people to be a part of my team so that I'm not doing as much and being okay with that. So, that was a big one because people used to say that I was married to Phoenix, to my company, and they were probably right. So
Woo.
I'm still married, but we've added some additional people to the relationship.
That's good.
So I think that's really one of the big one. And then now that I understand that, to our point, that just waiting for it to get high and then taking some apple cider vinegar and be like, oh, if it's down, I'm good. I think understanding that blood pressure is a consistency thing, not just rushing to bring it down, because that's even, in my opinion, worse, the ups and downs.
Yes.
So I think I now understand why they call it the silent killer, because when you hear that people have died in their sleep, it's yes, they have, but it's probably from things like I experienced. So something probably was happening. And so I've kind of reduced my stress on work, and then I have to be honest. I have been diligent about taking the blood pressure medicine. So I'm saying that because now I am an ambassador with American Heart Association, and I'm in the middle of a campaign to share with our women of impact. And I think it's really important to say, do not just wait for it to come down. You have to keep on the medicine. It
yeah.
has to be regular and consistent. So,
Yes, and speak to the American Heart Association, the campaign that you have going on. Talk a little bit about that.
yeah, so fortunately, like we have on red and white today,
Yes.
and we're in the middle of a lot of different things. And then, of course, with March being all about women, the American Heart Association does a great job of making sure that there's research and that doctors like we have today on the panel have tools and hopefully have some resources, because there's a lot that you have to cover. I mean, even in my job, just in marketing, that everything changes on a regular basis. So I was asked to be one of 8 women from Dallas to be what they call a woman of impact. So just to share, and I have been out doing things like this. And so we talked about fitness and habits. We're going to have a burn boot camp. I have a few get ready events that will help people give an opportunity to donate. So we have a boot camp that I know a lot of sorors are going to attend on March 9th. And also some give back days. So we're going to have something coming up at some restaurants, and proceeds will go to my campaign. So my goal is to raise at least $20,000 from now until April 5th so that I can do my part with the research.
That's absolutely wonderful. Congratulations on being the woman of impact for the American Heart Association. I think that deserves a round of applause.
Thank you. Thank you. Thank you.
Um, Getting back to heart health, how do I know if I have heart disease? How do I know if I'm at risk for a dissection or an aneurysm or a heart attack, stroke? How do I know?
So the American Heart, very active with them nationally and locally, but the campaigns have been well thought out in terms of how they've been marketed and put together. And a number of years ago, Know Your Numbers was a very important part. But I think that even though that's not the moniker we use now, but is so relevant, knowing your numbers is very important. Know your blood pressure. It's not good enough to go to the doctor and they say, well, what was it? Oh, it's okay. No, know the number, know what it is. Where do you stand? Goal of blood pressure is to be less than 130 over 80. Yes, both numbers, top and bottom. Knowing your cholesterol, the whole profile. Your cholesterol, the LDL, that is the low density lipoproteins, that's the bad cholesterol, the HDL, the good cholesterol. What are all four of those numbers for you? Knowing your family history.
Mm-hmm.
What did your mom and your grandmother and your siblings and your aunties and uncles, what did they, suffer with? That has an effect on you. There is a genetic connection. Knowing your own habits, right? So smoking, alcohol, dietary intake, sodium level. For African Americans in particular, sodium level matters a lot. You want to be less than 2,000 milligrams per day. Exercise matters. Sleeping matters. 8 hours of sleep per night matters a lot. We added that to what we call Life Simple 7 last year. It's Life Simple 8. And so adding those all together are the very first things that you can do. And then finally is getting a doctor, of your own doctor
Yeah.
that is really plugged into you, that you go to on a regular basis. You get all of those numbers checks. You sit down and have the conversation about every domain of your health is just helpful to you. It's like you wouldn't drive your car without taking it to get serviced. Why would you drive your body without
Absolutely.
treating it that way?
Wow.
And a specialist too. I mean, to echo that, I would love to lean in on say, and nothing's wrong with your general practitioner, but get a cardiologist in your life if you have ongoing or chronic blood pressure, because that's just like all of us. I mean, if we're a generalist, you only know so much about everything. And so I think in advocating for ourselves, definitely get a cardiologist where the only thing that they do all day is look at the heart. I think that is the one thing that I didn't realize is, in some cases, people are having to touch a lot of different areas of the body. So cardiology care that was the game changer for me, because I had my records, I kind of knew a little bit, and so I would say if you cannot get it to go down, get a cardiologist, and there's some good ones, but definitely board certified, and some of the things that you heard from from today would be good in my opinion.
Yeah, we
Wow.
appreciate the plug.
Absolutely. Yeah, it's really
Thank
true.
you.
Yes.
Yes, yes. So, Talia, I want to focus on your surgery and your recovery. Let us know, how long was the surgery? How long was the recovery from start to finish? Can you tell us about that?
Yeah, absolutely. So, picking up on, being in the room when I got to Las Colinas Medical and small hospital just near my house. And, I went in and blood pressure's normal. Everything's normal, right? But I did mention, and my husband was in the room, and he said, well, she does have the aortic aneurysm. And they said, okay, well, we'll do the CT scan. So the guy, they wheel me in, and I was just a normal person when they wheeled me in for the CT scan. When I got out off of the scanner, he was holding my hand. He was putting me in the wheelchair to roll me in the other room. And when I got to the other room, I said to my husband, I said, he was nicer to me than he was when I went in there. Something's wrong. And he said, oh no, you're just you know. And I said, no, he was more gingerly, he was nicer. And so when they came in, they said, it was a good thing you came in today. And I said, okay, why is that? And they said, well, you have a very good husband that made you come. I said, okay, how do you know? So I'm like, okay, how do you know I have a good husband? So y'all can tell my personality. I'm like, where are we going with that? And they said, we need to elevate your level of care, and we have some really good doctors. And I said, okay. And so I had my cardiologist on the phone because I was trying to figure out what it was that he said I had going on. And they said they recommended where they were going to suggest that I go. And he said, no, you need to go to Baylor. You need to go to Big Baylor. And I didn't know at that point what they were talking about. But the doctor said, you don't have time to get there. When they said that, I
You
said,
knew it
wait
was
a minute,
serious.
what do we mean I don't have time to get there? And
Mm-hmm.
fortunately, great bedside manner, they said, well, you do, but we don't want to risk we don't want to add any additional time. So I think after I realized, I think the time period from when that happens, it's kind of like your water breaking, right? You might have what, 6 hours
Mm-hmm.
to get into surgery. So fortunately, my cardiologist called Dr. John Roberts, who's head of that aortic area at Baylor. And like I talked about with specialists, for me, everything just lined up. I was able to go straight in to open heart surgery. I didn't know I was getting open heart surgery. So they, you know, couriered me or sent, I didn't care flight, but just the ambulance transfer straight into open heart surgery. So I was wide awake, had all my clothes on, had all my stuff, and it was kind of like, whatever. I mean, Grey's Anatomy. So they just rolled me straight in. The anesthesiologist came out to the parking lot, started walking with me and telling me what was going on. And I woke up 6 hours later, and fortunately, I mean, my scar is incredible. Great doctors. 18 months ago, it didn't look like this. But yeah, so full open heart surgery, which everybody probably knows what that is, but your heart's over here and everything's over here. Um, and they basically fix that vessel, right? Basically everything. I have a new vessel, that connects to my heart. So, so fortunately they know what they're doing. and, and so, yeah, so recovery, after coming out of that, they obviously said very lucky, because I don't have the stats exactly right, but they are staggering, that I don't know. They said 50% of the people die instantly. They
Wow.
don't even make it to the hospital. Another 50 die on the table. Another 50 die before they leave the hospital. So I was like, well, I did go to public school, but but are there any numbers left? I'm like, oh my goodness. so um so
Well,
that was the story, and so I had a couple of surgeries before, being a mom of 3. So I feel like a great patient, tried to be. So I did what they said, and I got home 2 days early. So I think that was great. So instead of being in the hospital 9 days, I left in 7. And that was,
Wow.
yeah. So I left, I think, on Mother's Day or close. And then I was at my senior daughter's graduation 3 weeks later in heels. So I
We
just
do
have
it
enough
all, don't we?
testimony. Yes. And people were like, how? And so, being the light and being able to tell that story is amazing. I fought for it. I fought for it. So your mind has to be right. I went through rehabs and didn't want to, I was complaining about who's going to do my work and what about my company and, but I fought for it and the recovery went really well for me and
Mhm.
been doing good.
Well, ladies, I want to thank you so much for being with us tonight. We're going to show the QR code for the American Heart Association so that people can donate to your cause. This is Talia Stafford Jackson. Scan the QR code, donate. Her events are on there. Everything to do with the American Heart Association is on the QR code. This is Talia Stafford Jackson and Dr. Shawna Nesbitt, a cardiologist. We want to thank you both for joining us tonight. I want to thank our audience that was here in the studio with us today. Thank you so much for being there. Dr. Nesbitt, I'm taking in everything that you said, really and truly. And Talia, to God be the glory. Your testimony is real, and we thank you for sharing that tonight. This has been Questions That Need Answers. Questions That Need Answers. This is a Fit and Fabulous Health and Wellness podcast. And today our topic was Matters of the Heart. We'll see you next time. Good night.
Good night. Thank you.